Did you know that something as small as a grain of sand could wreak havoc on your digestive system? Welcome to our channel. Today, we're diving deep into the murky world of gallbladder sludge, a little known but surprisingly common condition that could be silently affecting your health. Stay tuned as we unravel the mysteries of gallbladder sludge, its causes, symptoms, and most importantly, how to treat it effectively. Trust me, you don't want to miss this.
First things first, what exactly is gallbladder sludge? Also known as biliary sludge, this condition involves a mixture of microscopic particles like cholesterol crystals and calcium bilirubinate mixed with bile. Imagine your gallbladder turning into a tiny sandpit. It might sound harmless, but over time, this sludge can lead to serious health issues.
Gallbladder sludge often goes unnoticed until it leads to complications like gallstones or inflammation. This is why understanding the causes, symptoms, and treatments is crucial.
Now let's talk about what causes gallbladder sludge. The formation of this sludge can be influenced by several factors. One of the main culprits is rapid weight loss. Yes, you heard it right. Losing weight too quickly can actually increase the risk of developing gallbladder sludge.
Other factors include prolonged fasting, pregnancy, and certain medical conditions like liver disease and hemolytic disorders. Even certain medications can play a role in sludge formation. But let's dive deeper into these causes to understand how they contribute to the formation of gallbladder sludge.
First, let's explore the impact of rapid weight loss. When you lose weight quickly, your body metabolizes fat at a high rate, releasing more cholesterol into the bile. This excess cholesterol can form crystals that contribute to sludge.
Prolonged fasting or very low-calorie diets can also lead to gallbladder sludge. During fasting, the gallbladder doesn't empty as frequently, leading to bile stasis. This means the bile sits in the gallbladder longer, becoming more concentrated and prone to forming sludge.
Pregnancy is another significant factor. Hormonal changes during pregnancy, particularly increased estrogen levels, can alter bile composition and slow gallbladder emptying, creating a perfect environment for sludge to form.
Certain medical conditions, like liver disease and hemolytic disorders, also play a role. In liver disease, the liver's ability to process bile is impaired, leading to changes in bile composition. Hemolytic disorders, which involve the breakdown of red blood cells, increase bilirubin levels in the bile, contributing to sludge formation.
Medications such as ceftriaxone, a type of antibiotic, can precipitate sludge by binding to calcium in bile and forming insoluble salts.
But how do you know if you have gallbladder sludge? The symptoms can be quite sneaky. Many people with gallbladder sludge might not experience any symptoms at all. However, when symptoms do occur, they often include pain in the upper right abdomen, nausea, vomiting, and bloating. If you're experiencing these symptoms, it's crucial to consult a healthcare professional.
Sometimes, these symptoms can be mistaken for other digestive issues, which makes diagnosis a bit tricky. Let's delve into these symptoms in more detail to understand what you might be experiencing.
Pain in the upper right abdomen is the most common symptom. This pain, known as biliary colic, often occurs after eating a fatty meal and can last from a few minutes to several hours. It can radiate to the back or right shoulder. Nausea and vomiting are also common, particularly after meals. This happens because the gallbladder struggles to release bile efficiently, disrupting digestion.
Bloating and indigestion, especially after eating fatty foods, can indicate that your digestive system is having trouble processing fats due to insufficient bile flow.
In some cases, you might experience jaundice, which is a yellowing of the skin and eyes. This occurs when sludge or stones block the bile ducts, causing bile to back up into the liver and spill into the bloodstream. If you notice these symptoms, especially in combination, it's essential to seek medical advice.
So, how is gallbladder sludge diagnosed? The most common method is through an abdominal ultrasound. This non-invasive imaging test allows doctors to see the inside of your gallbladder and check for the presence of sludge. Other diagnostic methods include endoscopic ultrasound and blood tests to rule out other conditions and check for inflammation or infection. Let's take a closer look at how these diagnostic tools work.
Abdominal ultrasound is the frontline diagnostic tool. It uses sound waves to create images of your gallbladder. It's painless, quick, and highly effective in detecting sludge and stones.
Endoscopic ultrasound, EUS, is a bit more invasive but provides a more detailed view. It involves inserting a thin, flexible tube with an ultrasound probe into your digestive tract. This allows for high-resolution images of the gallbladder and bile ducts.
Blood tests are also crucial. They help identify signs of infection, inflammation, or other underlying conditions. Elevated liver enzymes, bilirubin, or white blood cell counts can indicate gallbladder problems. Together, these diagnostic tools provide a comprehensive view of your gallbladder health.
Let's move on to the most important part, treatment options. The approach to treating gallbladder sludge depends on several factors, including the severity of symptoms and underlying causes.
One common approach for asymptomatic patients is observation and monitoring. If you're not experiencing any symptoms, your doctor might suggest regular follow-ups with ultrasounds to keep an eye on the sludge. One common approach for asymptomatic patients is observation and monitoring. If you're not experiencing any symptoms, your doctor might suggest regular follow-ups with ultrasounds to keep an eye on the sludge. But what if you are experiencing symptoms? Let's explore the different treatment options available.
Lifestyle and dietary changes play a significant role in managing gallbladder sludge. Reducing fat intake is crucial, as high-fat diets can increase bile cholesterol saturation and promote sludge formation. Incorporating a balanced diet rich in fruits, vegetables, and fiber can support gallbladder health.
Maintaining a healthy weight and avoiding rapid weight loss are also essential. Slow and steady is the key here. Let's dive deeper into specific dietary recommendations and lifestyle changes that can help.
First, focus on reducing your intake of saturated fats. These are found in foods like fatty cuts of meat, butter, and full-fat dairy products. Instead, opt for lean proteins, such as chicken, fish, and plant-based proteins like beans and legumes.
Increase your intake of fiber-rich foods. Fiber can help improve digestion and reduce the concentration of bile. Foods like fruits, vegetables, whole grains, and nuts are excellent sources of fiber.
Stay hydrated. Drinking plenty of water helps keep bile in a liquid state, reducing the risk of sludge formation.
Regular physical activity is also crucial. Exercise helps maintain a healthy weight and supports overall digestive health. Aim for at least 30 minutes of moderate exercise most days of the week.
For those experiencing symptoms or at high risk of complications, medications can be a lifesaver. Ursodeoxycholic acid, or UDCA, is commonly prescribed. This medication helps dissolve cholesterol-based sludge and can prevent gallstone formation.
Analgesics and antispasmodics may also be used to manage pain associated with gallbladder sludge. Let's explore how these medications work and what you can expect.
Ursodeoxycholic acid works by reducing the cholesterol content in bile, making it less likely to form crystals. It's typically taken for several months, and while it's effective for many, it's not suitable for everyone. Analgesics, such as acetaminophen or ibuprofen, help manage pain, but should be used cautiously and under a doctor's supervision, especially if you have liver issues.
Antispasmodics like hyoscyamine can reduce gallbladder spasms and provide relief from biliary colic. These medications help relax the muscles in the gallbladder and bile ducts. It's essential to discuss with your doctor which medications are appropriate for your specific situation.
In more severe cases, surgical intervention might be necessary. Cholecystectomy, the surgical removal of the gallbladder, is often recommended if gallbladder sludge leads to recurrent symptoms or complications like acute cholecystitis. While surgery might sound daunting, it's a common procedure with a high success rate. Let's take a closer look at what you can expect if you need surgery.
Cholecystectomy can be performed using two main methods: laparoscopic surgery and open surgery. Laparoscopic surgery is minimally invasive, involving small incisions and a camera to guide the surgeon. This method usually results in quicker recovery times and less post-operative pain. Open surgery involves a larger incision and might be necessary in more complicated cases. Recovery takes longer, but it's equally effective.
Post-surgery, most people can return to normal activities within a week or two for laparoscopic surgery and a bit longer for open surgery. It's important to follow your surgeon's post-operative care instructions to ensure a smooth recovery.
Endoscopic procedures, like endoscopic retrograde cholangiopancreatography, ERCP, can also be employed to remove sludge or stones from the bile ducts. This minimally invasive procedure can provide relief without the need for major surgery. ERCP combines endoscopy and fluoroscopy to diagnose and treat conditions of the bile ducts. A flexible tube is inserted through your mouth into the digestive tract to reach the bile ducts, allowing for the removal of sludge and stones. ERCP is particularly useful if sludge or stones are blocking the bile ducts and causing significant symptoms.
Treating underlying conditions is another critical aspect of managing gallbladder sludge. Conditions like hemolytic disorders or liver diseases need to be addressed to prevent the recurrence of sludge.
Ensuring adequate hydration and regular physical activity can also support bile flow and reduce sludge formation. Let's discuss how managing these underlying conditions can make a difference.
Hemolytic disorders, which involve the breakdown of red blood cells, increase bilirubin levels in the bile. Managing these conditions with appropriate treatments, such as medications or blood transfusions, can help reduce bile sludge. Liver diseases can impair bile production and flow. Treatments for liver conditions might include medications, lifestyle changes, or in severe cases, liver transplantation. Maintaining liver health through a balanced diet, avoiding alcohol, and regular checkups is crucial.
Hydration is essential for keeping bile in a liquid state. Aim to drink at least 8 glasses of water a day. Physical activity stimulates bile flow and helps maintain a healthy weight, reducing the risk of sludge formation.
So, when should you seek medical advice? If you experience severe abdominal pain, jaundice, yellowing of the skin or eyes, fever, or persistent nausea and vomiting, it's crucial to seek medical attention promptly. These could be signs of complications related to gallbladder sludge or other gallbladder conditions. Early diagnosis and treatment can prevent serious complications and improve outcomes.
Prevention is always better than cure. While not all cases of gallbladder sludge can be prevented, adopting a healthy lifestyle can significantly reduce your risk.
Regular checkups and monitoring, especially if you have risk factors, can help detect any issues early. Discuss any concerns with your healthcare provider and stay informed about your gallbladder health.
We've covered a lot today about gallbladder sludge, from its causes and symptoms to treatment options and when to seek help. If you found this video informative, don't forget to like, comment, and subscribe for more health tips and insights. Share this video with your friends and family to spread awareness, and remember, your health is your wealth. Take care of it.